Good afternoon. We will talk about heavy menstrual bleeding today, and as you all must have experienced, heavy menstrual bleeding is one of the very common symptoms that women experience. However, it's a very subjective symptom in the sense that women who are actually bleeding very heavily may think it's a very normal thing for them, whereas women who bleed little, much lesser than a heavy period, think that it is very heavy. Unfortunately, there is no way of objectively measuring the amount of blood loss during a period, but anywhere between 30 to 60 ml is considered normal. Whereas if it exceeds 80 ml in a period, then you would consider that as a heavy period. What we tend to do is we take a detailed history of how many pads you use, whether you combine it with tampons, is it the extra large that you use, do you get up in the middle of the night to change your pads, do you have experience flooding, which means that you're soaking through your clothes, how often do you actually have to change your bed linen or your clothes, etc., in order to understand what is a heaviness. Also, the association with clots and flooding is one of the symptoms of heavy periods. Many women experience fatigue and shortness of breath and very sort of tiredness after a period, which may also indicate that you've lost a lot of blood during your period. Pain is one of the common symptoms associated with periods, but if the pain is getting worse month on month or is starting prior to the period itself, it may need to be checked out. As far as the causes are concerned, many a times we may not be able to, or we cannot find a cause for the heavy periods. But some situations such as polycystic ovarian syndrome, having fibroids, having endometrial polyps, which are small grape-like growths within the endometrium, and coagulation problems, that is the blood clotting problems, and also hypothyroidism, that is having low thyroid hormone levels, may contribute to heavy menstrual bleeding. Very rarely, it may even indicate endometrial cancer or the cancer in your womb. What we tend to do is we take a very detailed history when we see you and also do some basic baseline blood tests such as a thyroid and a hemoglobin. That would identify to what extent you've been having the problem and how anemic you are, as well as whether there's any problem with thyroid. We don't generally tend to do a scan unless we find something abnormal with the examination. As far as treatment is concerned, many a times treatment wouldn't be necessary. All we have to do is just watch and observe. However, if treatment is required, we usually start with simple medications which help reduce the flow. Those medications help up to almost about 70%, 50 to 70%. If the medications do not work, we go on to the second line of management, which are different kind of medications, including hormones. And if those don't work, then we go on to the next level, which includes an intrauterine system. However, finally, as a last resort, we do resort to either endometrial ablation, which is like cooking or basically burning the endometrium, or hysterectomy. As far as in general, heavy menstrual bleeding may be treated with simple medications, as I said before. And however, if it's associated with pain or if it's getting worse month on month, it certainly would need to be checked out. Thank you.